I knew when I felt something wasn't right, when I felt the lump, that I needed help right away, and I figured that I wanted to go to the best place. It was suspicious, so they did the biopsy the next day.
When I first met SueAnn, she really wanted to have bilateral mastectomies with reconstruction and just have both of her breasts off. But she did not carry a high-risk genetic mutation, and she had a fantastic response to her chemotherapy. So we determined that her risk of developing another breast cancer or cancer in the other breast was not significantly high. So in order to avoid the big surgery of the mastectomies and reconstruction, we talked about oncoplastic surgery, which would essentially remove the tumor in the same way that you would remove a tumor when you do a regular lumpectomy. So you remove the disease but leave the rest of the breast intact. But it also allowed us to give her a really good cosmetic outcome at the same time.
Obviously, it's a world of chaos. When you find out something's going on, everything goes through your head, all the things that could happen. And she was very good about keeping me focused, and she explained everything in detail and drew a picture right away. When we saw her the first time, she took out a diagram and drew a picture for us, so I knew exactly where it was, how big it was, what I was dealing with. With a lumpectomy, it was pretty straightforward, I guess, what I thought could happen, and I didn't know that there was this option, and that was exciting to me because I'm young and I have a lot of years left, and to have this option was really interesting to me.
We have really good data that shows how safe it is from a cancer perspective. So from an oncology perspective, it basically has the same outcomes as doing a regular lumpectomy, but from a cosmetic perspective, it gives you a lot better cosmetic and aesthetic result. And that's really important because with women living longer and longer after their diagnosis, they have to live with the results of the surgery that we give them. And so we're trying to make it so that they feel good about their body and themselves well beyond their treatment time.
For me, the surgery was probably the easiest part of all of this, which was a pleasant surprise. I had incisions and I had some steri strips with it, and it was, a couple of weeks till that kind of stabilized, but it wasn't a big traumatic thing like I had built up in my mind that it could be.
Surgery went great. SueAnn was fantastic. She was really thorough. She did all of her research. She considered it really carefully. She talked to her family about it. She talked to other physicians about it in our team, and really was, I think, comfortable with the surgery when she made the decision, which is a huge thing.
In the middle of fear and feeling fearful, to feel hope in all of it too, and not to give up, to keep researching and keep coming up with your questions and keep going on. And for me, that was the key, is just do the next right thing.
Right now she's cancer-free. She's finished her radiation, and she's just finishing out her Herceptin treatment, which is more systemic therapy. I think she has about 3 treatments left. And once she's done with that, we'll remove the port that she has in her chest, and then she'll be port-free and cancer-free. And
self-exams, keeping my regular OBGYN appointments was important and is important, and trusting your gut and being your own best advocate. You're all you've got. And if not for yourself, but to do it for the people who love you,